the throat. And so right along the jawline, just below the lower lip, go back to the base of the ears and get all this skin off of there carefully. And then on the side that you're dissecting, you're going to go from about the corner of the lip up, just caudal to the corner of the eye, and just a little over the dorsal midline, and then back down toward the neck, and then pull all of that off. And you can remove the ear by cutting, as you're pulling the hide up, you can just take your scissors and snip right through the base of the external ear and pull that all off. And that way you'll expose the muscles on the side of the head that you have to see. Okay, for the axial muscles, the trunk muscles that we have today, or this week, we want to clean up some of the fascia and fat over the surface underneath the pectoralis. So if you haven't bisected the pectoralis, now's when you need to do that. And the latissimus, so get those out of the way. And as you clean away on the chest, you'll see this big Serratus Ventralis that we saw earlier, strips of the serratus coming down to the ribs. And we're going to be working around behind that in a few minutes. And we're going to avoid those to see the muscles that we need to see hypaxially. So the first of these is kind of an extension of the rectus abdominis. So if you remember the rectus abdominis running on either side of the midline, it's this longitudinal strap muscle that goes up onto the sternum and ribs. And in cats, it goes quite a ways up onto the sternum. What we're looking at here, this is all an extension, the cranial extension of the rectus abdominis. And at its cranial-most end, it has a kind of a branching that goes at an angle craniolaterally. And so right here, the rectus abdominis sends a branch laterally onto the ribs, and that's the rectus thoracis. And so those form kind of a Y shape where the abdominal portion, the rectus abdominis, is the leg of the Y, and then on either side there's a little arm going off as the rectus thoracis. And just dorsal to that, you can see another strap of muscle that's coming from just dorsal to all the nerves and veins that are coming out of the chest into the arm and shoulder. And that is the scalenus. And the scalenus will form a band of muscle coming down from the lateral cervical vertebrae and going out onto the ribs. And in the cats, most of these you'll be able to see about 3 strips of muscle from that going out to their attachment to the ribs. And so this is the longest of those right here. And then there'll be usually a littler one going dorsally and another littler one going ventrally right around where the rectus thoracis is. So that's the scalenus, or scalenes in humans. And then the other muscles that you have down here are the intercostals. And the easiest way to get to those is to continue your dissection that you did through the external oblique and peel that back to expose the last few ribs. That way we're not cutting into any of the other muscles like the Serratus Ventralis that's coming down onto the ribs. And as you do that and then clear the fat away from the surface, you'll be able to see the ribs. So here you can see the actual cartilage, the costal cartilages of those last few ribs. And in between those will be muscle. And if you need to go kind of laterally on these guys to find the outer layer of muscle that's going to be running from rib to rib. And that's the external intercostal. And deep to that is the internal intercostal that's very similar to the external oblique and the internal oblique under that. And beneath the ribs, or deep to the ribs, is the transverse thoracis, which you need to really look for that more medially. So the external oblique is more lateral and it's real spotty as you move medially in the cat. And the internal oblique is the internal intercostal is most of what you see as you get more medially. And deep to that, near the sternum, is the transverse thoracis. Okay, now for the epaxial, and to find some of the other axial musculature up here, you need to go back to your dissection of the scapula. We'll clear out some more of this fat here. And we want to kind of abduct the scapula a little bit. The axial muscles that we're going to follow up through there go deep to the scapula and come from all the way from that erector spiny group that we saw back here. So remember back here under the thoracolumbar fascia, we saw the multifidi right along the spinous processes, and then a large erector spiny muscle lateral to that. And that erector spiny will split up into 3 columns going up by the ribs and up to the neck and head. And to see those, we need to bisect the rhomboideus. So if we clean this up a little bit, remember the rhomboideus went from the cervical and thoracic vertebrae to the dorsal border of the scapula. So if you kind of expose the edges of that, and while you're doing that, if you haven't done that already, remember the cranial-most slip of the rhomboideus goes all the way up to the skull. And I like to kind of free that up from the rest of the rhomboideus so that we have rhomboideus capitis. And I usually don't bisect that one and reflect it. I like to keep it there just so that it's easier to keep track of when it's still attached to the scapula. But we are going to bisect the rest of the rhomboideus, the cervicis et thoracis, which are all these slips that are going to the vertebrae from the scapula. And the trick to that is clearing away those slips as much as possible and then making that bisection through the middle of the muscle so that you've got a pretty healthy stub coming off the vertebrae and another distal stub coming off the scapula. Let me see. Okay. And the other thing we want to watch out for is the serratus ventralis that's coming down from that same part of the scapula, that same dorsal border, and we don't want to cut through that. Okay, so once you do that, then you expose all this musculature running along the dorsal and lateral axis. And here are the proximal halves of the Rhomboideus cervicis et thoracis. And the muscle running along the axis is covered by a fascia right here that forms a sheath over all of these axial muscles. And we want to cut into that sheath, excuse me, kind of carefully, so that we can lift that sheath up off of the deeper musculature and try not to cut into those muscles. And once we get that sheath cut, we can reflect it to expose those muscles. And that sheath, this is one exception to the don't cut through a tendon rule that I gave you earlier, because that sheath is the aponeurosis for another muscle that we need to identify. If we look here on the surface, you can see little very thin sheet of muscle that inserts onto the ribs. And you can see this zigzag pattern at the border of it. This is the Serratus Dorsalis. So Serratus Ventralis is this large fan-shaped muscle that's now exposed. Its medial surface is now exposed. And the Serratus Dorsalis lies just deep to that. And it is arising from this aponeurosis on the vertebrae and inserting onto each of the ribs. And so its tendon is this sheath that I've been clearing away. And usually I like to cut through that sheath about in the middle of that tendon. And just lift it up with a pair of forceps, and then cut through that connective tissue. And you want to watch out right here, because there is, toward the midline, more medial to this tendon, is a muscle that you can usually see the boundary of it. It's kind of a semicircle or D-shaped muscle. And that's one of these longitudinal muscles that we're going to be identifying. Then once I cut through that aponeurosis, you can try to carefully peel it back ventrally. Pulling it away from the body wall. And it's not separating real nicely here, but this guy has quite a bit of fascia kind of getting in the way. But as you pull that back, you'll see that attached to the connective tissue that I snipped through is a very thin layer of muscle, so that you can see that muscle as you look through the connective tissue. That is the Serratus Dorsalis. So I'm holding the tendon right near the edge of the Serratus Dorsalis, and that muscle inserts down here onto the ribs. So we want to try to cut that so that we can see the serratus dorsalis, but at the same time, we're cutting it so that it'll expose these longitudinal muscles deep to it. And you can just carefully scrape between those. And you can see these columns of muscle that are running longitudinally. And I'm going to cut a little bit more of that tendon so we can see it a little better. And then peel that back. And when we do that, you're going to be exposing 3 columns running right next to each other that are continuations of that erector spiny group. So the erector spiny group is going to split up into, or give rise to, 3 columns of axial musculature. The most lateral of these, usually once you get that serratus dorsalis peeled away far enough, you can see these diagonal tendons. Those diagonal tendons are the insertion of the most lateral of those columns, which is called iliocostalis, because it's going to the ribs. So each of those tendons is going to a rib. And that'll continue up to beneath the scapula here, and then kind of fade out or give way to these other muscles. Then dorsal to that, or medial to that, is a pretty substantial column that consists, and we can kind of find the border for that here and here. This middle column is the longissimus. And right here, it's the longissimus dorsi. And the longissimus is going to ascend cranially and will insert onto the vertebrae and continue as a little slip that inserts onto the base of the skull as longissimus capitis. And we'll see that in a little bit. And then the medialmost column starts with this D-shaped muscle I mentioned before. And this muscle goes from vertebrae to vertebrae. This is the spinalis. And then cranial to, and that goes, it's kind of hard to see because it curves up and it ends right up here cranially underneath the rhomboideus. And then it gives rise or gives way to the continuation of that medial column, which is semi-spinalis. So the semi-spinalis goes from this point up to the cervical vertebrae and head. And we'll get back to that in a minute. So those 3 columns are iliocostalis, down here going to the ribs, longissimus dorsi, and spinalis. And then to see the more cranial extension of those, we have to cut through a thin muscle that's not part of the erector spiny group, but lies over the surface of it up here. And that thin muscle forms a cape. Starts back here, and it forms a triangular cape that goes over the surface of those muscles I've just been talking about, and just deep to the clitocervicalis. And it'll be just deep to this rhomboideus capitis. And so the trick is trying to find the lateral border of that cape, and then cutting through it, we're going to cut through it kind of at an angle like this, up toward the base of the skull. And once you find or think you've found the lateral border, if we lift up that thin superficial muscle a little bit, let's see if I got any. It looks like, okay, there it is. See if somebody can hold this head steady here. Just while I'm cutting through this thin. That scapula just gets in the way. And this muscle that I'm cutting through is the splenius. So you've got a lot of confusing names in this group that are similar to each other. Don't confuse the Scalenus and the Splenius and the Spinalis and the Semi-Spinalis. But as we reflect the splenius, the muscle underneath that is the semi-spinalis. And I think I'm going to kind of free up this lateral border of the splenius, just so that I can reflect it a little easier. So I'm holding the splenius up here, and underneath that is a large semi-spinalis, cervicis et capitis, because it goes to the cervical vertebrae, and the cranial most part of it goes up to the base of the skull. And then also underneath that splenius is an extension of the longissimus that forms just a little bundle that also goes up to the skull. And that's the longissimus capitis. And I'll go back through these in a minute here. So I'm still peeling splenius back. Okay, so here's semi-spinalis, and if we remove the splenius over the surface of that, we can see where the semi-spinalis starts, right about here, and that's the cranial end of the spinalis. And so the spinalis is kind of shaped convexly like this, and then the semi-spinalis is shaped kind of convexly like this, anterior to it. So all of this is semi-spinalis cervicis et capitis. And if we clear away the border between that Semi-Spinalis and the Longissimus dorsi. It's kind of shredded in there, but back to here, the thoracic region, iliocostalis, longissimus dorsi, and spinalis. And as we move forward, the iliocostalis ends, and we get longissimus dorsi giving rise to a little strip that goes up to the head, longissimus capitis. And spinalis gives rise to semi-spinalis underneath the splenius. And I think that's all of them that you have there. There's one other that I haven't shown you on these. That's longus coli, and it's better to see all these before you get to longus coli. Longus is a tough one because it's hypaxial, but just barely. It runs right underneath the transverse processes of the cervical vertebrae. And so, depending on your animal, it might be easier to see that from a ventral view, like right up here in the neck, or to see it by digging deep from this dorsal view. And I'll show you guys that later. And I'll also show you the hypobranchial musculature on the throat and neck later.